Then, you still remember the parts? Yeah?
Yes.
I will ask you then. What do we call this? Okay, what's this?
Deceleration chamber.
Discharge. Okay, let's go. How many pumps?
4.
Five. Big one for
The middle.
and 4 pumps for the scapes. Okay, effluents, free blood pump, dialysate, replacement. What's this?
That is
Pressure sensor.
Pressure
Yeah,
port.
for which one? Which one?
Return line.
Access.
Effluent. Okay, effluent pressure port. This one for filter, filter pressure port. And this one for access. Okay, this is for return pressure sensor. Here for aeration chamber.
Air
Air detector, exactly, and
Blood
this
leak.
is automatic clamp. Okay, remember from down we have this fluid
Sensor.
leakage sensor. So remember, do not cover the base of the machine. Okay, so it's on. Okay, now once we start, you know that we have the 2 buttons, therapy info and continue. What do you usually press?
Therapy.
If you need therapy, otherwise continue.
Continue. Okay. Now, here we have different buttons. They forgot somebody. Although here we have different buttons. Custom mode, right? Therapy info, new patient, same patient, lost history, download data, and help. Okay? I will check on all machines, but I need it from your side before you prepare citrate. Just to press custom mode,
Custom mode.
press continue,
Custom mode.
go to citrate calcium. Okay? This is just for checking. You didn't start the session. Okay? Just I need from you to see these parameters. So please take a photo of it and check all machines.
I will just share so no stress for you guys.
Yeah.
I will be stressed.
Okay? So you should see on all machines this page. Anyway, from my side today, I will check on all machines that they have all these parameters, so nothing to check from your side, but double check. Okay? Then press confirm. So you can come back to the same screen. Okay? So from custom mode, just you press on citrate calcium just to check that all parameters are accurate. Okay? Oh, that's difficult. Come back to custom mode so I can explain what you will see. Sorry. Custom mode, continue, citrate. So what we are seeing, therapy, CRRT. Okay? Next. Citrate solution, it's called prismocitrate, right? 18/0. Next is citrate dose, 3 millimole per liter blood. Okay, this is the default settings and we keep it like it is. Then, advisory period 1 hour. What does it mean, advisory period? Remember when I told you every hour, actually not the first 2 hours you need to do ABG? So you can keep like a reminder on the machine to remind you to take the ABG now. Okay? Next, calcium is calcium chloride 10%. So this is what we will use in the syringe. Then, calcium compensation 100%. What does it mean, calcium compensation 100%? It means we consider that the patient, he will lose all of his calcium, ionized calcium. So that's why we need 100% to compensate it through the syringe. Okay, so that's why the calcium compensation is 100%. Okay? Next button is replacement concentrate, calcium concentrate. In the replacement in Foxelium, I told you we have phosphate, right? Also we have calcium, 1.25. So we already entered on the machine. So just please, before you start the session, just double check that you can see these parameters.
But this all default, huh?
These are all default. Okay?
All the machine, huh?
Yes, all the machine. Then confirm. So now we want to start the session. What do we press?
New patient.
New patient. Good. What do I need to enter? ID. weight, hematocrit, right? So enter ID, anything you want. Enter. Now we need to put patient weight, for example, 80. Then enter. Now enter the hematocrit, also for example, 35. Enter. So here to confirm the patient information, right? So confirm. Now choose the therapy. We go for CRRT, which is already pressed. Which modality to choose?
CVHDF, no?
HDF. Always CVHDF. Okay, even in citrate, always CVHDF. Now, here's something new for you. Choose anticoagulation method. See the first two options for citrate, right? The first one is citrate Prismaflex syringe pump. So it means we will use this pump. The second one, citrate calcium external pump. So it means you will use infusion pump. Don't choose it. It will be very difficult for you to monitor here and to monitor the infusion through the infusion pump. Don't do it. Let the machine do it for you. Okay? So choose the first one, which is citrate calcium Prismaflex syringe pump. Okay? Now, here just a notification for you that CVVHDF treatment performed using the citrate anticoagulation with integrated calcium infusion and requires citrate solution on the PBP. See, it's telling you here to put the citrate. Requires calcium solution delivered by the syringe pump, so you will deliver calcium here. Okay? A dedicated infusion line must be used to infuse calcium from the Prismaflex syringe pump to the patient. So here where you need the calcium line. Yes. Here where you need the calcium line. Okay? So we will confirm. So let's check the therapy and the anticoagulation. Therapy, CRRT, therapy mode, CVHDF, anticoagulation, citrate calcium, citrate solution, prismocitrate. Here are the specification of it. Calcium solution, calcium chloride 10%, and concentrated of it is 680 millimole per liter. Post replacement we have calcium. So I'm just reading, okay? Just double check on these, okay? Then continue. Now we will load the set. Same steps how you are usually doing, okay? So first step, snap cartridge into carrier. Fix it like this. Okay. Then we need to put the pressure poles. You know, this is for the effluent.
Elizabeth's nose well.
Then for filter. Then for access. Okay. Next is to install the discharge ring and the blood leak detector. Exactly. So this is the discharge ring. And then the blood leak detector line, we push it inside, we pull up and down to make sure it fixed well. Okay, always ensure this U line not too long
Pink.
and not too short. Okay, then temporary hang access effluent Y line on priming hook here. Then place the aeration chamber in its holder, attach monitor line to the return pressure port. So here is the chamber. Here is the return pressure port. Close counterclockwise. Okay, I'm doing it quickly because I know that you know it.
Yes.
Sure?
Yes.
Yeah.
Okay. Then insert return line into air detector and return line clamp. Close door of air detector. So here to open, put the line, close, and same line into the clip. The last one, open effluent scale, hand collection effluent bag, close the same one, and use the items. Then we press load. So confirm set loaded M100. So this is M100. So we can confirm. Now we need to prepare and connect solutions. So number one, route lines through to pin guides. Make sure lines run freely. So here to guidelines, our lines as per the color. Then connect access effluent Y line to priming solution bag. So now we will connect the Y line, and remember now no need to add heparin to the saline bag. Okay? So just you will connect it to the saline bag. Then connect pre-blood pump line to PBP citrate solution bag, hang bag on white scale. So now it's time to put on white scale. So white scale, white to white, exactly. So we'll go with that. Prismo citrate bag, okay? So Prismo citrate bag 18/0, it's white cap from down, okay? Bag, it's one compartment. Okay, so there is nothing to mix. Okay, so just take it. Then we will take the white line. Remove the spike. Yes. Instead of bending. Okay, and put the bag on the scale. Make sure there are no lines behind the scale and close. Okay. Next one for dialysate. Connect dialysate line to dialysate bag with calcium-free solution. Hang bag on green scale. So now for the green scale for dialysate. Exactly the green. So here is the bag, Prismo cal, okay? It's a green cap, okay? This one with two chambers because it has all the electrolytes except the calcium, okay? So we'll squeeze and then mix and
Plus bicarb is there. Bicarb is
yes,
there.
Here's the green. So see green for the green. Then
Not grey.
connect replacement line to replacement bag with 1.25 millimole of calcium and hang bag on purple. So here to put the oxalium.
Blue one, no? No color. No purple.
Not purple, no.
We have to keep it.
Okay, so here we have the foxalium bag, which will be fixed on the foxalium, okay? Remember the bags, please.
And he's taking video.
They need to order each bag alone,
Each bag has
okay? Then we have the purple.
Some will forget everything.
In which bag we studied that potassium 40.
Both
Except the last.
citrate and
As for them, they are
Dialysis
giving
replacement.
separate, no need to.
No, it's already come.
Already added it.
Yeah.
4 milli, maximum 20 millimole.
Which has no potassium? Which bag?
Citrate and no
The
potassium.
dialysate. So sorry, which one? With
No potassium citrate.
No potassium citrate.
Zero potassium.
Okay, citrate is only citrate, no citric acid, just citrate, chloride, and sodium. That's it. Okay.
This 3 has sodium, no? 3 back.
Yes.
So
So
the sod-
normal ranges.
It will not go up. No, patient
No. It's only 1/4.
142.
Okay. Then connect return line to collection effluent bag. So here we have the return line. We're connected to effluent bag, correct. Okay. Then last step, clamp syringe line on set. The line will not be used, so syringe line here, you will not use it. So just clamp it.
But we will connect now.
Use this line. This is just for heparin.
Later we will connect.
We are not using
Lengthy
it.
one, right? 200 ml.
But when we press that, it is like which syringe we use, right?
Yes, so we choose the first option.
First
It was
one.
citrate Prismaflex syringe pump. So we'll use this pump, and here we will put syringe. We will connect it to this line directly to the patient. So this
Okay,
line no
syringe
use.
will be connected here only.
Yes, syringe will be connected here, but this line not used.
The
Okay,
flow
okay.
is
Not
adjusted
the
by the
external
machine,
pump.
but
Yes.
we are not. It's not going to the machine directly. It's going to patient.
Exactly,
Okay.
correct. Because remember here no heparin, here just calcium. I am compensating to the patient the calcium that he lost during the treatment. Okay? So now we will press continue. Is it clear?
Yes.
Clear?
Yes.
Okay, continue. Now, let's install calcium syringe. See the name? It's
Yeah.
calcium syringe. Now, the first one is open plunger clamp latch, press auto down, remove syringe if already installed. So open the plunger. We support here to avoid breaking the handle, and then we open the plunger. Okay? Then we press auto down. Next step, connect 50 ml Tiro Mobidi, any brand you want, syringe filled with calcium chloride 10% to a dedicated calcium line for the Prismaflex. So here is our syringe. Remember how many ampoules I need to put?
Five.
5 ampoules of calcium chloride 10%. Okay? So
Which is 10 ml each.
which is 10 ml each. Yes, exactly. So 10 ml till 50. Okay? Now, here is the syringe line. Okay? Here we will connect it to the syringe. Okay? Now, next, place syringe holder, insert syringe wings into the syringe holder slot. So here, to put the syringe.
It is coming with the filter. This one is coming.
Yes, exactly, correct. It's coming with the filter itself. Okay, here I can put the line if you want. And get it. Okay. Next, hang the calcium line in the clip. So here we fix it in the clip. Then press auto up. Next, close the plunger clamp latch. So we put this in the center so we can close the plunger. Okay? Till now, don't connect this line to the patient. Okay? Then we will press continue. Now let's confirm syringe installation. Number 1, make sure that syringe contains the following calcium solution, which is calcium chloride 10%. Make sure that the wings are secured in the syringe holder. Yes. Syringe line is unclamped. Yes, it's unclamped. Okay. And the plunger is closed, so closed. Now we can confirm. So now we will start with the priming. Okay. So let's check here. Priming solution required for the set is 1000 ml. So yes, 1 liter ml is enough. What we need to make sure that calcium line is not connected to patient. Yes, not connected to patient. Then unclamp any clamped lines except the unused syringe lines. So all the clamps are open except this syringe line. Then verify that all connections are correct and secure. Check that the connections are all of them secured. Check here, here, check this one. Then verify appropriate prescription solution for the therapy. Yes, citrate on white. Here the prismocal on dialysate, foxirium on replacement. So we can go for either prime or prime plus test. It's up to you.
So before we
And after priming, if you want to do extra priming, you can do it for the seal. Okay? See?
It also move.
okay.
Now it's a priming.
Need for us to do.
Only one time in this, if you move the machine, we do it too.
If for example we primed it already,
So-
we no need to clamp.
Which one?
For example, we have somebody prepared for you. They primed it already. This one.
Okay.
No
okay.
need to clamp it. No, just leave it.
Leave the medicine will be wasted.
Yeah.
Okay.
That's
Will overflow, is that you mean? Okay.
Otherwise, machine will show that it is not right. It will create problem. But even medicine wasted, no problem.
Yeah.
So now we will wait or until you see this pump. If you see this pump running, then you can tap. Now we will wait. Is it difficult so far? No.
No.
It's
How,
okay.
how many times you have to do the priming? Only one time?
Sorry.
One time priming?
Yeah.
For the
many times
because we are using the heparin the two times.
Because you are adding heparin.
Yeah.
Here no heparin, it's enough for
only one.
Unless if you are having air bubbles still in the set, then repeat the priming.
Okay.
Okay?
Only one point.
Yes. Sessions besides with just the only thing that you need to do just to monitor frequently the ABGs, diionized calcium, okay? And the most important thing is diionized calcium from patient. That's what I do care more than the session itself, okay? One last thing, just for ionized calcium from patient, usually from where you are taking it? Arterial lines.
Yes, but it's
Most of the patient.
for venous also.
Most of the patient.
Otherwise, we
Most of
will
the
take
patient,
from the
because
central
if it is
line.
No, this one we can take from here, no? The
Central
first.
line.
Central line.
If you don't have arterial line, you are taking
Central-
central line.
line.
Good.
What about this porter? This porter?
Great, thank you for the question. Yes, this one, right? To be honest, we didn't use it before. We don't think it will be accurate.
Why? Why?
Because
Very
look,
Yes.
see the white line, see the citrate. Citrate, the infusion actually will be here, and then coming with the blood, and then coming to the filter, right? So if the flow rate is higher, maybe some citrate will come to
It
it.
has to go.
Yes.
So when you take a blood sample, the ionized calcium will not be accurate. Okay? So if you have arterial line, most of your patients have your arterial line, right?
Yeah, most
Or central line.
central line or
Central
arterial
line,
line. Yeah.
if it is this is 3 lumen, we are not inserting central line.
Sometimes our
Then we
doctors
have to
are
prick
If
it.
the line is triple lumen,
We are using inotropes, that for the 3rd lumen. Then we have to prick the patient, no choice.
If there is no central line, no arterial line,
Sometimes, yeah, sometimes.
then
Very
you are using the triple lumen of the catheter.
No, even controls.
For the normal.
third lumen we are using. now.
But you told we should use for calcium.
calcium, that will go
That's
for
my
calcium.
No, but he's telling they are planning to put on the return line.
Yeah,
return
she
line.
told to prefer the.
No, but in case 3 lumen we are using the inotropes, what we will do?
You can take blood samples from there.
No, we will not take it, but I am asking about this one.
Yeah.
Last
but
choice or
my
what?
question is, if patient, do you have a patient without arterial line, without central line?
Yeah, there is.
Sometimes.
How you are taking then blood
Our
samples?
doctors are sometimes like, see,
Then their doctor will put middle line.
No, sample we are taking the line. This is here.
Okay, then in our case you can take from here.
Last.
Last
So you need
Last
either-
option.
Last option, yes, because it's not accurate 100%.
Okay.
So
This
you
we
need
need to
either
talk to
arterial
our
line to
doctors.
have it or central line to have it.
Yes.
Okay, don't take blood samples from the triple lumen
അന്നേരം നമുക്ക്
because
മിക്സിംഗ്
you're already
ഒന്നും
having
ഇല്ലല്ലോ.
calcium.
If sometimes it is really emergency, we have to stop and resume like that. If you do like that, then you clamp this one, then there is no backflow to here now. I don't know.
Ah, okay, yeah.
This is what sometimes
Uh,
can work.
Can
Because
work,
we-
yeah. If you would do it every fourth, yeah.
Because this is pricking and taking, and your machine is saying do ABG 1 hour.
But I don't think so. There will be valve or
So by the
something.
time, just stop,
My question is that
clamp,
Okay.
take it and resume it. Okay.
That, but you
this
need
is
to
maybe one way valve.
Yes.
Ma-
It will not be, it is less than 30
I
seconds.
agree with you that look to
Where you will clamp, bro?
Then your machine will say, of
You
course.
say there's no problem.
Yeah.
No, no, no. My question is maybe that is one way valve. It will not go back. Otherwise, they will not put the sample pot there.
No, again, I didn't get
This is like a one way
Maybe
valve.
it's safe
This
to
one,
aspirate,
yeah.
you said.
Yeah.
That's otherwise they will not put the sample pot there.
No, but this they put sample port for even for normal CRRT.
No, normal CRRT, even
Yeah,
if
so
the
you can take it
replacement
from
is
here.
fluid is mixing there, no. There
Yeah,
only
but-
replacement fluid post
Here.
this, yeah.
Yes,
So
yes.
we are taking sample from there. There
Still
is a
there.
chance of dilution. Yeah,
Yeah,
I
but a
don't think so
little
that
bit, a
valve
little
will be
bit.
like that.
Yeah, it will not be much.
That we need to do actually look. To be honest with you, I didn't take a sample from here, so I didn't know what was the value.
Resultant. We will
The
try.
result. So try from your side.
Like this, no?
When you have
The-
arterial line.
We are even doing a stop and resume. No?
To
He's
compare.
already doing it anyway. Your own ways. I am with you. I am with you. So let's so let's see.
If patient
Yeah.
is already bleeding,
Yeah,
uh,
citrate is the best solution for it.
Yes.
With the citrated.
Coagulation problem.
Because
This is the
Yeah.
best.
yes, because the anticoagulation is only working here. No, it's not affecting other patients. Yes, that's why citrate is the first option for these patients. Okay. So here we have reprime. So to repeat the priming again, full reprime. Here we have reprime calcium line. So see here I have a special option for the calcium line. If you want to reprime it again, it's already primed. But if you want to reprime it again, you can reprime it. Manual prime. This is if I still have some air bubbles here, so I can press, hold, and tap. Okay. See on the top of the filter, I don't have air bubbles. Plus the level in the chamber, it should be within the line. Okay, so within the line, no air bubbles, it means the priming is good. No need to repeat it again. Okay, then we can go for the test.
Pressure have some problem.
sensor
Prime self
is
test.
fluent.
Yeah, so where?
Top there.
Exactly, correct. So see when we have malfunction, prime self-test, I should read this due to pressure cold sensor effluent. So it means this one. Okay? Look what will be my action. Remedy possible causes. Press retest to start prime self-test again. So I have a retest option. This is number 1. Number 2, if retest fails, press reprime to reprime the set again. So if I do the same alarm, I will reprime again the set. Again, if I am having the same alarm, press a new set to retry with a new set. So you can try with a new set to see is it a problem from set or is it problem from machine. Okay?
That we don't want.
Now, if there is again with a new set, I'm having the same alarm about effluent,
Machine.
then disconnect and inform that there is a problem with the machine. Okay? The idea is we need to try one time, twice, third,
Yeah.
as much as we can with the same set. Then I might try with a new set before I inform that there is a problem with the machine itself. Okay? Maybe it's just repriming. There are still more air bubbles in the set, so we need to reprime the set again. Okay? So I will go with the first option, the machine set. Press retest. Okay. I will just remove it.
Retest.
I will check if it's inserted well. Then I will press retest. So it will repeat only the last 2 parts of the test. I just
We're just
try
cleaning,
to
yeah.
check the positioning of the pressure probe. I remove it, I put it back. I do reprime, I repeat the priming. Sometimes I just turn off the machine, then I turn it on.
Then we have to
and
remove
then I
everything.
reprime. No.
No need.
Zero, no?
Once you turn on the machine, it's after priming. Okay, just turn it on again. Then there will be option for new prime or continue. You will press continue, then the machine will ask you to reprime again. So you can reprime it again.
Oh, okay.
Okay?
Sometimes remove and just clean the part and put it back.
Exactly. Sometimes just to clean it. If there is something on the sensor itself, just
It will
use
not
to
transfer.
clean it. Especially for this one.
Yeah,
Okay, sometimes you might have false blood leak alarm.
yeah,
Just remove the line, clean the line and clean the sensor and make sure it's dry.
yeah.
Then put it back. Okay?
Reprime.
And reprime again, yes. What else we can do?
So you will keep it as recirculation.
Maybe have such a voice that may be significant also to others. Your question?
He doesn't like
You shy.
It is going to OR, imagine. So we can keep recirculation for 4 hours. How many hours we can keep?
Saline recirculation
Saline.
is 2 hours.
2 hours. So
Okay?
you told there is an option off and on and then continue. Can we do that?
No.
No,
That
oh, like that
recirculation
we
we
cannot
can connect and restart, you know?
Only 2 hours.
No, no,
No, that we have to,
Just-
we have to
we need
reprime
to
with a
be,
new set.
we need a blood pump
Wait.
there.
Turn off, turn on, there is a problem. Okay? You send the patient to OR,
Maybe more than 2 hours, 3
no
hours.
problem. Do saline recirculation. Once the 2 hours are finished, you have to do reprime.
Reprime, yeah.
There is a reprime option on the
Yeah,
machine.
But
Do
the hour,
reprime and keep the machine ready.
Prime with the new saline.
no,
we
but
will
the
prime.
our policy say you have to discard. There is there is a chemical changes like that.
Yeah. It was like that.
Yeah, 2 hours, 2 hours. I learned from,
Recirculation is only 1 hour.
1 hour.
Okay? No, but you can keep it because you already
that's
reprimed
what
it.
I
Keep
learned
it.
from that.
If the
have
patient
to
is going
discard
to, yeah.
So
If it takes more than 2 hours, within 4 hours,
2 hours,
doctor say do the priming and start the same thing.
Same thing.
Yeah,
But the
I did
policy
that.
says always
We
discard.
also
That's
did
what
that.
I learned. I don't know whether they changed or what.
It's more than 4 hours. You
Not
do
more
no.
than
2 hours.
More than
More than 2 hours.
2 hours, lesser than 4. He told you do the repriming again, same and start.
remember
I did.
And keep it ready. If the patient, let's say, after another 1 hour, come back to you, reprime it again. So fresh saline in the set, then you can connect the patient. Okay? But if your policy is saying that's more than 4 hours, you want to discard, it's okay, this is your policy.
Okay.
Okay? So now, priming done, self-test done. See, it passed. Okay? So what do I need to check? No
Remedial.
further priming can be done beyond this screen. So this
Remedial,
is the
okay,
last screen for reprime option. Okay? So here we need to, it's okay, no worries. So first, visually inspect that the fluid level in the deaeration chamber is as shown as the illustrator. So how's the chamber? It's okay? A little bit less. Let's see. We still have some saline, so we can increase. Okay. Now confirm level. Number 2, verify red status light is flashing on the top. Okay. Inspect Prisma Flex set for air. If more priming needed, use manual prime. If total reprime need, use reprime. So here you have manual prime. You have, again, you can reprime the calcium line again. And we have reprime option if you want to repeat the priming because you are having too many echoes. Okay? Then last option, inspect calcium line for air. If air is found, press prime calcium line. Repeat until all air is not available. So let's do reprime. No worries. So reprime calcium line. So see what's telling you? Yes. Press prime to prime the calcium line. Okay, no more air bubbles in the line itself. Then inspect the syringe and calcium line. If for air, you can also do prime again. When priming is completed, press continue. Okay. So now no more priming to do. Our patient is ready, so we can press continue. Now, enter treatment settings. Patient fluid loss 400 ml per 3 hours. Do you know what does it mean?
Yeah, lots of gain we are putting.
What does it?
Like, you know.
Perfect, exactly. So it's a safety limit from any fluid imbalance. It might happen during the treatment because we are not attending the alarm, especially about the bags. Okay? Or let's say this clamp, it was closed. Okay? And I am not saying this, the machine giving me flow problem alarm about white. I'm keep checking here, there is no problem, but I am not checking this one. Because this one, mostly, you can't see it because it's under the sheet of the patient. Okay? So that's why I always assure this one it's open. Okay? So what we do here? Nothing. Just confirm. Now, enter flow settings. Okay? So now we need to put the flow rates for our patient. Protocol. Exactly. Body weight is
80.
Okay? To teach you how to remember the numbers.
110. 60 plus.
140, I think.
I'm not remembering.
Let me teach you how to remember it. Blood flow is the body weight plus 50. Okay? So 80 plus 50 means
140.
130.
130.
Okay?
Calculation also.
Calculation problem.
130.
130.
Better print the guide.
This is the good idea. 80 plus 50.
50, yes. Yes.
Plus 50.
Now, the next one is what?
Dialysate.
Dialysate.
How?
So, 130
Yes.
multiplied by 10.
4,300.
1,000. Ah,
Ah.
Okay? 1,300.
10.
I will call Chechi if you are
Yes.
I'm not remembering. I will write and take. Okay. I will
Now,
not
the
remember.
next one is replacement.
Yes.
Replacement is between 500 to 700. This is the range.
Yes.
Okay, so you can put 500. If you don't remember it, just remember the thing.
500. Okay.
Don't forget to put a post. Na?
Pause. It should be pause.
Yeah.
Post all the time. See, there is no button.
The previous
Why?
one there is a
It will calculate.
Automatically
Because
defaulted.
there is no
Of
replacement
yeah,
for
it
this
is
one.
a
No replacement.
citrate
we
will
are
be the
setting.
pre, no?
So it is.
Because there is calcium here. If I will put it pre, then I will give the blood more calcium. So more clotting in the filter. Okay, but we already informed the machine that the replacement, the post, there is calcium, so the machine will keep it post all the time. Okay?
Pause.
Anyway, these are defaults. There's nothing to change from your
Default.
side. Okay?
Wait.
Patient fluid removal, this is as per order from the doctor. Okay? Clear for these? Blood flow, you can start gradually. You can keep it 100 at the beginning because you are starting the session. Later, you can increase it until you reach 130. Still 130, it's nothing for the patient. Okay? Usually, in normal CRRT, we can't keep 130. And then you will have clotting. But here, you can keep it. Okay? Clear for the flow rates?
Yes.
Can you see filtration fraction?
Based on any weight you are keeping this 500 to
32%.
700 the replacement that your
1,000 ml
suggestion.
per-
Suppose your patient is
Look, go back to the protocol.
32%.
Don't worry,
Yeah,
don't remember.
32%.
Okay, just go back to the protocol anyway. It will be good.
32%.
Okay. So how much filtration fraction?
32%. 32.
Accepted or no?
no.
No, it's fine.
Here we accepted. That's what you are saying.
Exactly.
Yeah.
That's the trick. In citrate, I don't care about filtration fraction.
Okay.
30, 40, 50, I don't care. Okay? Because remember, citrate is removing all the clotting factor from the blood. So don't worry about filtration fraction. Okay? Good?
Yeah.
So confirm. Now, enter anticoagulation settings. Now, the anticoagulation settings for our citrate and calcium. First one is blood flow. Initially, I kept it 100. Later, I will increase it. Okay? Next is citrate dose. The dose by default is 3. It's a 3. Okay? Also, do not change it. Now don't change it. Then, calcium compensation. I told you it's 100%. Right? So keep it also 100% for now. Because I am just starting. Then, patient hematocrit, this is you already entered. Okay. Next one is a changed syringe or line. So if you want to remove the syringe, maybe you didn't put calcium, you want to put calcium. Anyway, from beginning you already put calcium. No need to change it. Okay? Clear for these? So see, I didn't change anything. Citrate dose I kept 3, calcium compensation 100%. Okay?
Yeah, no, if I can
Yes.
just stress regarding the blood flow, I think we need to stick to what is actually placed in the protocol. I know that you are conscious with the hemodynamics of the patient, because later on you will tell me I forgot to increase the blood flow because I was caught missing with all these things. So it would be better that even from the start you follow the protocol as it is.
To keep it from the
You have to
beginning.
keep it from the
130?
beginning, because for
Okay.
sure, in our settings, it is very easy to be distracted. You are going to start this one, and then you will be going to help another staff, and then you will be
So you will
entangled
forget.
there, so you will forget. So better from the start itself, go and go with the protocol. Then you will be safe, because anyway, if your patient is really having hemodynamic instability, you're not going to put removal right away, right?
Yes.
Yeah, and then more or less you will not be. If it's really like at the maximum level of vasopressors, then I don't think that you're going to start CRRT, and your doctor would start CRRT. So
Okay.
from the start,
It's up to you.
yeah.
Okay. So let's make it then the maximum, make it 130. Okay? Then confirm. So this is just a notification, okay, about the anticoagulation risks. Let's see what's here mentioned. Consult physician for specific risk due to increased citrate load due to high blood flow rates, okay? And citrate accumulation in disease states that can impair citrate metabolism, such as liver insufficiency. So estimated patient citrate load is 12.1 millimole per liter per hour. So this is just a notification for you about the amount of citrate that the patient he will gain. Okay, so he will gain 12.1 millimole per hour. Okay, this is just a notification. Nothing to do from your side. Okay. So continue. So let's review the prescription. Look at the flow rates. Are you accepted?
Yes.
That what history for, right? Yeah.
All good for the flow rates? What about the anticoagulation? All good for the citrate? The concentration, citrate dose, calcium compensation? All fine?
Syringe rate is 6.4.
That came automatically with the.
Yes. See, syringe rate, we didn't put any rate for the flow rate. It's automatically come by itself. What about the pre-blood pump?
It's also there.
Did you see it?
1,300.
It's also there. Okay, 1,300. Okay, so also by it will finish. So it's also by the machine.
I think it says he's
6.4, so 5
But still you are a replacement.
to 4
So,
hours.
yeah.
Replacement it will take more time.
Citrate is expensive.
No, not too much.
Don't say expensive. They will
The
not
difference
start.
between the normal bags is not too much. Okay? Remember, you are saving set.
Yeah, because this
Mild failure.
how much
Yeah.
syringe? Doctor will
The doctor will
That's their discretion to decide whether to start or not to start.
Exactly, that's from the doctor's side.
That is contraindicated.
Yes,
because
for
it's
severe liver failure,
Will not
the
happen.
citrate is contraindicated
Yes.
because it can't be metabolized in the liver.
correct.
Okay? So all good here. Again, filtration fraction, we don't care about. Okay? So just continue. Now let's connect the patient. Number 1, clamp all Y lines, access effluent, return lines. Normally, how you do it? Normally the same.
Yeah.
So clamp here, Y line, access, effluent, and the return. Next, disconnect access line from Y line and connect to red lower lobe catheter. So, the access you will disconnect and connect to the patient. Okay? Now the blue, disconnect return line from collection effluent bag and connect it to the blue line of the patient. So disconnect the blue and connect it to the patient catheter. Next, disconnect effluent from Y line and connect it to the effluent bag. So effluent line to the effluent bag. Next, connect the dedicated calcium line to the patient secure line in a clip. So now my question for you, where you will connect the calcium line? Give me the options.
The center line.
Center line, number one.
Then
Number
third
one
lumen.
of the catheter, number two.
Return
Number
line.
three,
Return line.
return line. So let's consider I have a patient now, doesn't have central line, doesn't have any triple lumen catheter. So where I will connect it? Return
Turn line, three-way.
With the high,
Remember.
high.
Another important thing. If you will connect this one to the central line, don't take ABGs from central line. Because you are giving calcium, so it will not be accurate. So take it from arterial
Even
line.
another fourth of the central line.
It will have some.
Don't take it. Take it from arterial line. Okay?
Same like
If
your parent.
I connect this one to the triple lumen of the catheter, and this line also has like three-way connections. Also, don't take blood samples from the same line which is connected to calcium. Okay? Take it from arterial line, or if you have central line far away, take it from central line. Okay? So the idea that we need to take a blood sample from a place where there is no infusion of calcium. Okay? You are out of options, no arterial line, no central line, then you don't have only this one.
Okay.
But again, as I told you, still it's not accurate. Okay, because we are afraid of having citrate coming to this port from here.
But you have any competent list that we can use together with the citrate? There is 100% no issues, something like that.
List for what?
Means like normal saline or to connect
Compatibility.
compatibility.
The compatibility with the calcium. All the vasopressors you can use it.
Suppose you have
I think that TPN, right?
and we are never
TPN it's contraindicated for the calcium.
I'm not sure.
you are right,
So
na?
to better guide yourself, try to check there in our compatibility checklist. There is a guide there. Okay? If it's not available there, you have lexicon that you can refer to. Okay? I hope all of you know
Sorry,
where to
no.
find lexicon.
We are connecting to the return line.
Return line.
So you can take the water from here, blood from here.
Yeah, here you will take it. This is the post filter. Okay.
Yeah.
So you will take a sample from here, but you need another sample
Patient.
from
Patient.
patient.
two sample.
Because to your
Because you have two
Ratio.
ABGs to do. One from here, this is mandatory from here, and one from patient side. Okay? If you have arterial line, it's the best one. If you don't have arterial line, take central line.
Arterial line.
Okay, because sometimes what is happening here is that they are actually even running CRRT with patients having no central line and no arterial line. So we are left with an option of getting the patient sample on this port. Okay, so
Then, in that case,
Rajesh has suggestion.
I'm thinking about is
Yeah, to hold the machine.
stop. So all the pumps will be stopped. So no infusion of citrate.
okay,
And then he will take the sample,
okay,
and then he will resume directly.
that's okay.
It
Take it from the expert.
I'm warning
But
about
this
that.
one I don't know. As per
We have to
no.
find out.
This
This
one
is
as
a
per
one-way
Renu
valve.
saying, maybe
I don't
something,
think so.
yeah, something
I don't
is
think so it will
there
mix
to
with
secure
it.
nicely.
Because there is a valve here. maybe
Actually,
here, no?
actually, even if you're going to, if mixing is most likely to happen when you're going to stop But if you're going to keep on, no, if you're not going to stop it, because there's this sucking motion, no? So the direction of your blood is from the patient going to the device. So
I
more
don't
or
think so.
less, you will have a clean specimen here. You will have a clean sample.
I don't think so. It will come back.
See if it is something like that.
Instead of putting it on the central line, because we have a lot of new
It's
stuff.
concentrated, no?
This is concentrated. This is concentrated electrolyte.
Chance to-
They can push. They can do boluses and these things. These are far more dangerous than having an inaccurate sample.
It's up to
No,
you. It's up to
even you are taking the blood sample from, suppose there is a 3 port, you use one port for the citrate, where you will choose that port,
Not
in the
citrate,
proximate
calcium.
or wherever. Then you taking the sample from other port also, still there is a mixing happening.
That is why. That is why.
Yeah,
No
it's
need
not a
to
big
think
deal.
about that one. Go with the
Yeah,
return.
but still we will check.
Ah,
We will make sure, then you standardize, take or not to take colors.
Okay, look at this. Look at this. For the record, for the purpose to prevent the central line contamination, bro, you can make the is that calcium? The return to the calcium to that three-way access high flow back to the patient. Then we can use our central line for.
No, we have
That's
the
it.
high flow.
High flow. Okay.
same diameter.
Yeah, same time.
Yeah, big one.
Yes.
That's for CRRT.
So then let's do it like what you are doing. What you do it.
This is actually good.
But actually,
this is good.
no, but
But
when
this
you are
is
going
coming
to-
along with the
when you
setup.
go- It will
cake?
no?
This is
All up to you.
It's all up to you.
we can say this one.
Don't come running and
Priming it. Priming.
Yeah, good. Not good for
Okay. Type.
aspirating.
What does it?
No, that is return going to the patient.
So,
with
Okay.
let's consider. So this is the patient. Okay. This is
this is the patient now. Okay.
and this is the catheter of the patient. Okay, red and blue, not white line. Okay, so now my patient, no arterial, no central line. So I will use the Y line or your three-way high flow
Return.
connector. Okay, so this is the return. So I will connect it to the return, always to the back to the patient, regardless of the color. Okay.
yes,
So
return.
usually it should
Always
be
to the
blue.
return.
So I will connect it to the blue, which is coming back to the patient. Okay. Now, on one side of this Y line, I will connect the return.
And then another
The
one
second line will be the calcium.
This is the
Good. No confusion. Okay.
Yes.
Now the catheter red line is red.
Yes. Red to red.
Good.
Good.
Confused?
Can I ask something?
Yes.
Okay. Because this is also a practice here where they switch.
We are
That's
already.
what-
We are
That's
missing
what-
it. We are out of class. We are out of class.
Sorry, I'm multitasking.
Finished already.
We finished the
So what was the consensus? Agreed? Not agreed?
We agree,
But you need to.
but the
As the physician.
Agreed with reservations. It's okay.
Yeah.
I'm getting it.
When you swap, be careful that you are still putting the
yes, yes.
calcium back.
Okay.
Okay.
You swap the whole.
Set.
No, I mean the
Yeah, this one. The whole.
Yeah.
Take it from here and swap it.
Yes.
Okay. But all good. So then you are agreed. The last step is to unclamp. Unclamp catheter. Unclamp access. Y line or your three-way. Effluent. Sorry, the return. Effluent and already the calcium line also it's unclamped. Okay. Now we can press continue and of course you can connect the warmer anytime. Then you can start. So let me just make the pressure correct.
No. Because this is saline.
Of course you will not clamp anything. I'm just
Yes.
clamping to make a pressure.
Pressure.
Okay.
It's not that hindi siya viscous as well.
Okay. We insert some eyeball.
Mhm.
Well,
Now let's have a look at the screen. Can you see anything different than normal CRRT?
BB citrate,
Baby citrate.
EFR dose.
Three have already we mentioned.
It's there. Filtration fraction is at
Filtration was reduced after the settings.
That's okay. Nothing except that the label of PVP citrate is there.
Everything same.
Exactly, PVP citrate.
citrate.
Okay, so everything is the same.
Anticoagulation?
You have the pressures, access, filter, effluent, return, info, TMP, everything the same.
Anticoagulation.
Anticoagulation.
Ah,
Now
this
I
is
have
where.
more things to read. Okay,
Citrate solution.
so what do we have? Citrate calcium. Citrate solution, prismocitrate 18/0. It has citrate 18 millimole, citric acid 0, bag volume 5 liters. So this is about the citrate. Okay? Now, how much the dose? 3 millimole per liter of blood. Flow rate for the PBP 1,300 ml per hour, automatically by the machine. Okay? Here, patient citrate load 12 millimole per hour. Now, calcium that we are using, calcium chloride 10%, and the concentration is 680 millimole per liter, already entered on the machine. Okay, it's nothing from your side. Now, here, the post replacement, there is calcium 1.25, calcium compensation 100%, hematocrit 35%. How much the flow rate for the syringe? 6.4 ml per hour. Okay, and here how much the dose I am giving of calcium? 4.3 millimole per hour. Okay, so these are all by the machine itself. Now, what I will do after 1 hour?
ABG and abortion.
ABGs, 2 ABG samples.
Post filter.
One sample from here.
Post filter.
Okay, post filter, the blue one.
Yes, sir. Yes, sir.
Okay.
Okay, so take from the first one here, and the second one we agree from arterial line or central line, where we don't have calcium. Okay? So, one important thing, when you are taking the blood samples, all pumps should be running. No alarms.
Okay.
Because if there was an alarm about changing bags, no infusion of citrate. So when you take a sample here, you will find the ionized calcium very high. Then you will change a lot. So this is not accurate. So please don't forget this. When you want to take both samples, either from patient or from machine, here, all pumps should be running, no alarms at all. Okay? Now, we took the 2 samples. We took them to, yes.
If there was alarm, for example, should we wait for like 15 minutes or no?
Yeah, that's good. Wait for 10 to 15 minutes, then take samples. No problem. Okay, no need to wait for more than 10 minutes would be enough. Okay.
Very good, Kathy.
Now you took the 2 samples. Okay, from the ABG machine. From patient side, it was 1.1. Machine side, it was 0.35.
So it's
I cannot memorize anymore.
My papers, I think still.
Okay.
Machine side, 0.35.
0.35 normal.
Normal, both of them.
Yes.
Normal.
So what you will do?
normal.
Keep it same.
keep same.
Keep same.
No change.
Keep same. Okay. Now the second hour, you will again repeat the ABGs. Patient, post filter. Okay. Remember, what's the size of the needle that you are using here?
Blue one, no?
23 and
Small,
25
small.
and 20.
25.
The blue one. Blue one. What is the size?
24.
22.
Smaller, 22.
No, blue one is 25, right?
The blue one is 23 and the orange one is 25.
Ah, okay.
Orange one, it will not reach it. Then no, it will
Not
not
reach.
reach.
21. 22. Size 22, it's accurate. Okay? Not a 20 or 21, it's very big. So it might.
The rubber
rupture.
bottom.
Okay, 22 and 23, these are good.
Yes.
Right. Now, the second hour, you took again 2 ABGs. From patient side, 1.15.
Oh, then still within.
Machine side, 0.45.
Where's that?
0.45 increase citrate dose by 0.2.
What is that section?
Patient service, patient service.
Yeah, 0.045. Then high.
So
Then
increase
here.
what?
High.
Citrate.
How much is it?
0.45.
0.4. It is high, na?
Which one it fall? This is second,
So it's
more
high.
than this one.
Patient.
Normal.
So what you will
Increase
do?
the citrate dose.
Increase citrate dose.
Exactly. Exactly. How you will do it?
Those days
Adjust.
Anticoagulation.
Increase the dose by.
Okay.
So have to look, follow the intersection.
How much it should be?
Okay.
3.2.
Increase by
Follow
0.2.
that
3.2.
like this.
Then confirm.
3 plus 0.2.
Okay.
3.2.
0.2 add.
Okay.
Okay. Again, this is just to notify you that now citrate load is in maths is bad.
I must always maximize.
Okay.
So the ml.
Okay. Sorry. So see now what changed.
Citrate solution.
PBP citrate increased.
3.2 milligram.
And syringe rate also.
Citrate.
Perfect. Yes, exactly. Because I increase now more the citrate.
87. Increase to 87. 1387.
1387. It was 1,000.
That's a 300.
Also the
calcium
also a little bit.
Thing,
Why? Because
adjusted
now
it.
I'm giving more citrate, so I should give patient more.
Okay, so is it safe
But
to
it
say
is not
now-
showing the protocol, no?
Automatically it will go
It
up.
will go automatically.
Increase the citrate.
No, it's already
Oh,
showing.
okay, so you can only adjust either or.
Yes.
Either or, not both altogether.
Yeah.
You can do both.
Ah, this
For
one.
example,
Okay,
here or
here.
here. Okay.
Ah.
Type. Let me give you another example.
They supposed to increase both.
Patients now, so after 4 hours now, so now you did it at the second hour, you can repeat it after 4 hours because from patients still okay. So after 4 hours now you took another 2 ABGs.
Once we did some changes and wait for 4 hours,
First 2 hours,
okay.
1 hour.
it's
then
okay
4 hours.
after 4 hours. I mean, we did some changes now.
Look,
For
previously
24
we
hours
were
every
telling
4.
them to, I think even the protocols to check it after 2 hours, right?
It says.
Type, check it after 2 hours.
For
It's in the
24 hours.
protocol.
Eh?
No, I said 4 hours if there is no change.
Changes. But if we did some changes,
Yes.
we need to check after 2 hours. So, okay.
Okay. Why I look at the beginning we will keep it like this. Maybe later, once you find everything is fine and normal, you can repeat it every 4 hours. Anyway, you'll find it normal, so you can repeat it 4 hours. So now another IBGs. Patient size now 0.9.
0.9.
Low.
Machine size 0.5. 0.5.
0.5.
High.
High.
Increase
High.
citrate dose
Filter
by
post.
0.2 and
So
increase
follow
calcium
this
by 10%.
section.
Blood and increase calcium compensation by 10%.
So both.
10%.
So anticoagulation, but go to anticoagulation.
Yeah, let's wait for 1 minute until we finish the
Just
self-test.
Increase citrate and increase the calcium. Thank you very much.
Is it one nurse will be responsible for one patient with CRRT?
Yes.
Ah, good.
Yeah, because in CCAD there's two patients.
In
Even
Cleveland? you mean?
Yes, in CCAD.
Ah, really?
They will have 2 patients even with CRRT.
Ah, really?
Yeah,
I don't know.
because they have technician there. They have CRRT technician.
Cleveland or in SSMC?
Even in Cleveland.
SSMC also same.
And the
Huh?
medical
SSMC also.
SSMC they have a CRRT technician.
But they are doubling, no?
They are still doing
But they have all the help for jumpy this.
Citrate dose of 0.2 millimolar.
No need.
Adjust. Okay. Increase citrate dose.
Okay,
This one.
Go
back.
Okay.
Okay. And then anticoagulation. Go to anticoagulation.
Anticoagulation.
Then adjust.
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 Okay, but just increase the citrate dose of 0.2
0.2.
Citrate dose, second
Citrate.
one.
0.2.
3.4. 3.4.
Yes.
Okay, and then
Calcium
and
compensation.
then calcium.
Component increase
Compensation.
10%.
110. 110.
Increase 110.
110.
No. Your replacement should be go up to 550.
No.
No, that's the one, no? You will go with.
No, it says
550
increase calcium
Calcium compensation
compensation by
by
10%.
Yeah, your calcium compensation is This one is the replacement for the 500, no? No?
Then for the calcium compensation.
This is already 100%, no?
It's
No,
not
can increase it.
This is the one.
Started with the 100%.
Plus 10.
10%.
Then continue.
Estimated citrate
13.3 citrate powder.
Now citrate
So just interpret this one as it is.
1473. 1473.
The ml 7.3.
6.5? Yes. 7.3. Increase. That's it. That's the whole citrate.
That's why this need be there. This need in the always. That's what she said to keep this one.
So this one we
Do you know if
The significance.
pressures are normal, not normal?
This abnormality will allow.
There is a color.
Correct. Type. Access, is it negative or positive?
Negative.
Negative.
Return.
Positive.
Okay. If you saw access and return below 100, it means the flow rate is very good from the catheter. And look, right now, I am at maximum blood flow, which is 130. Okay? If I made it higher, 150, for example, forget the citrate, I'm just talking in general. Okay? If we made it 160, for
It
example,
will increase.
more pressure on the catheter to increase. Okay? So now blood flow is higher and still the numbers below 100, it means the flow from the catheter is very good. Okay? If you saw the numbers more than 100, still accepted, but they should not reach to 200. 200, it means there is a problem from the catheter or clot or kinking. See? Now I will have alarm.
200.
Okay? Access extremely negative, it's minus 200 or more. So it means, what are the causes for this?
The baby is dry, there is a chance of
Clotting, patient,
King.
maybe patient moving, okay, coughing, okay, or kink from the catheter itself, or kink from the line, access line, or closed clamps, okay. That's why I might flush the catheter itself to see how's the flow from the catheter, okay? Check the position of the patient, position of the catheter, especially when you have femoral one, okay? Check that there is no kinking, or maybe the blood flow, you put it very high, so the catheter is not tolerating. So I need to reduce a little bit the flow rate, okay? See now, once I fix the problem, the pressure is back to normal, so we can press continue. Okay?
The position of a catheter inside the veins.
Yes, also this will affect. I'm just putting by the nose.
And
There the vein will be
because look,
TMP.
trans-
When do you stop transmembrane pressure? When do you stop the session?
it's more than 300.
They will not stop the pressure.
If it is more than 300,
more than 300 also we are running.
Yeah. No, please. You'll have a clotting then. So at the 300, it's better to stop.
300.
Yeah, better to stop.
The magic number is 300, so you are able to return the blood to your patient.
Yes.
More than this, you will have a clotting, so you can't return it. Okay.
Fluid gain.
The unintended patient fluid gain or loss. See now it's 25. Okay. If it will keep increasing, and once it reaches 400,
Alas, the machine will stop. No?
yes, you already shared here.
Warning.
Warning to stop the session. Okay, so please be careful. Be careful. None of the lines are touching the bags.
Okay.
Not even the warmer. Not even the bed. Okay.
The remaining all troubleshoot coming the same like.
Same. Access is
Then without the
negative,
systemic, you will have to come.
same positive,
replace it.
same flow
High
problem.
is
Same.
I think I need to liaise with the pharmacy regarding the concentration of this one.
Yes.
The
We
calcium.
need to order because they will come as ampoules or a pre-filled syringe. Because the calcium chloride.
so same in crash cart coming, same what?
Yeah,
That is
it's a
also
blue
done.
one, right?
Ah.
10 millimole is coming in our crash cart.
I know.
10%. Same, yeah, 10%. Same.
Yeah, that's 10%.
10%.
It's also 10%.
10%. That is the one.
What's calcium gluconate?
Okay, so no calcium gluconate.
But in the
Use calcium
CRRT, crash card we are using calcium chloride.
Calcium chloride.
that's what
Yeah,
I
that
mean.
is the
That's
one
what I
blue.
thought.
Okay.
Because it's more concentrated, so the flow rate for changing is low. Okay.
The order should be
When you
calcium
use
chloride.
calcium gluconate, it's less concentrated, so chance for changing is very high. Every 2 hours you need to change.
Okay, so in case they're using that one, calcium
yes,
gluconate.
yes.
Okay, so we have calcium chloride.
Chloride.
Okay. And we do not use calcium gluconate in adult.
Yeah.
That's good.
This is, I already told them, guys, you don't use your machine for citrate. Because in your machine, I already put only calcium chloride. I didn't put calcium gluconate. And their machine, they have two. They have calcium chloride and they have calcium gluconate.
Okay.
But
because I
they're
don't want
borrowing
to
our
confuse
machine, no, sometimes.
That will be for different purpose. But we will just, if they're going to borrow, just inform them that they cannot use this one for.
Normal CRRT, they can
Normal,
use it, no
they can.
problem. But for citrate, no. Okay?
Why they're using gluconate there, and for us, for the pediatrics,
Because it's less concentrated for
lesser
pediatric.
lesser volume.
So even the volume, the flow rate is very less.
Okay.
Okay, so that's why. But for adults, no. We need
So
a more
we will try
concentrated.
to check on the calcium chloride availability that we have, because if at all you need to start it surasura, maybe we can get it from there. Just put it in. But it will be.
No, that how this is a
5
different
pieces.
You're going to
practice, no?
aspirate
Yeah.
5 pieces, no?
5 pieces we need to,
Practices.
yeah.
Let them
Number-
prepare
Let
at
the
the
pharmacy.
If there is